Hello and happy International Women's Day 2021. So a very, very warm welcome to everyone who has tuned in for today's discussion. It's already, or maybe I should say only, the 110th International Women's Day. And so it's a great opportunity worldwide on this really important and multifaceted day to take a moment and take stock not only of where we are in terms of gender equity, but also where we're going. So today, we're going to look at this through the lens of public health, and more specifically, neglected tropical diseases. Now, I probably don't need to remind this audience that when it comes to health, women and girls do remain disproportionately affected by diseases. They carry the burden, whether as patients or carers to their affected communities, and this is hardly marked more starkly than in context of neglected tropical diseases. We all know that from what we have seen firsthand, and actual data remains fairly sparse. And the burden affects women in many different ways. So let's take the example of trachoma. What we do know is that women are 4 times more likely as men to develop permanent blindness from infection. When it comes to other diseases that are stigmatizing, women again bear the brunt and of ultimately discrimination, stigmatization, and vulnerability. We also know that although women make about half of the world's population, they hold only 10% of the income. So when these diseases do have an impact, it can be really, really far-reaching. So the issues around gender inequity and inequality in health are extremely important, not only in terms of understanding the current public health landscape, but also in achieving those really ambitious goals in 2030. Now, we know that a large part of this burden of NTDs falls on the African continent. But when it comes to tackling gender inequality in neglected tropical diseases, we are in good hands. Women, and particularly African women, are at the forefront of the fight against neglected tropical diseases, from carers, community drug distributors, and in leadership roles at the international level. This particular field has many African women in leadership roles. To name just a few, Dr. Mwalimu Stella from Tanzania is head of NTDs at the WHO. We have Dr. Matshidiso Moeti from Botswana, who was the first woman to be elected WHO Regional Director for Africa. And in a slightly different field, Dr. Ngozi Okonjo-Iweala of Nigeria, who was recently made history, actually, by becoming the first female African Director General of the World Trade Organization after moving from Gavi. So, on this International Women's Day, I'd first like to start by acknowledging this powerhouse on many levels of women at all stages of the public health landscape, tackling the fight against neglected tropical diseases. But is this enough? Despite huge achievements, women still only make up about 30% of researchers worldwide. And although they make 70% of the world's health workforce, they only really account for about 25% of leadership roles. So today, it's my pleasure, in partnership with the Global Schistosomiasis Alliance, the SCI Foundation, Core NTD, the African Research Network for NTDs, or ARNTD, in partnership with all these fantastic organizations, it is my honor today to be part of this panel and take a closer look and hopefully unpack some of these issues and dynamics. In fact, we'd like to be a little bit bolder, perhaps, and embrace this year's theme of Choose to Challenge. And what we're going to choose to challenge over the next hour is gender inequity in neglected tropical disease research, and specifically discuss why we need more African women in NTD research and what we can all do about it. So we will hear on this topic from a fantastic panel of speakers. Sorry, I felt quite passionate about some of those issues, so I've gone on a bit, but I'm delighted to now hand over the floor to be joined live by our panelists. First and foremost, I'd like to introduce Professor Margaret Gyapong. Hi, Margaret.
Hi.
Hi, Margaret. You are Professor and Director of the Institute for Health Research at the University of Health and Allied Sciences in Ghana. We'll also be joined by Dr. May Sule, Senior Research Associate in Water Quality, Climate and Health at the University of Oxford and Imperial College London. Hi, May.
Hi, Mariam.
Hello.
Thanks. I'm glad to be here.
Nice to have you here. Thank you so much. It's also a pleasure to welcome Dr. Stella Kepha, research scientist at the Eastern and Southern Africa Center of International Parasite Control at KEMRI in Kenya. Hi, Stella.
Hi, glad to be here.
Same, really glad to have you with us today. And finally, Ms. Chinenye Afonne, you are a PhD student and TDR fellow at the University of Ghana in Legon. You're also field manager at the Epidemiology and Biostatistics Research Unit, IAMRAT, at the University of Ibadan, Nigeria. Welcome, Chinenye.
Hi, everyone.
Hi, and also a huge and very warm welcome to our numerous attendees. We've got people tuning in from all over the world. It's definitely an international day. Hello, Damaris Matoke Muhia. Hello, Maria Cambra from Spain. Ibuafung. Hello, Luisa Duamoa from Ghana. Lisette van Lieshout from the Netherlands. I can't mention everybody, but a very, very warm welcome to this really international audience as well. So first and foremost, before we really delve and ask you some burning questions about your huge range of experiences and thoughts really on the role of African women in NTD research, I'd like to share with you some opening remarks and some thoughts that were given to us by Mariam Otmani del Barrio. Mariam is a scientist leading gender and infectious disease research at the TDR, the Special Program for Research and Training in Tropical Diseases based at WHO. I'm sure many of us are very familiar with that. Mariam has 15 years actually of experience working on the interplay between public health, gender and infectious diseases. And so to open this session, before we move on to our discussion, I'd like to share with you a few words given to us by Mariam.
Thank you for inviting me to celebrate with you this year's International Women's Day. For those of you who aren't familiar with TDR, it is the Special Program for Research and Training in Tropical Diseases. It is co-sponsored by UNICEF, UNDP, the World Bank, and the World Health Organization, and it is based at WHO headquarters in Geneva. We support innovative global health research by strengthening the research capacity of disease-affected countries and by promoting the translation of evidence into interventions that reduce the burden of infectious diseases and build resilience in the most vulnerable populations. Understanding gender dimensions has always been a critical area for TDR. We know that gender roles, norms, and relations intersect with other axes of inequality, such as age, experience of racialization, social status, or disability, and influence why and how health is shaped in a specific way. They also influence vulnerability to infectious diseases, access to healthcare, and also how people experience and respond to disease and treatment. This is relevant in infectious disease implementation research because otherwise we would ignore those social dynamics, including gender-related dynamics that take place at community level and influence how or for whom a health implementation strategy works. We support in TDR intersectional gender analysis in research to generate new evidence to inform health policy and practice, as you can see in the video that follows.
Gender, sex, and their intersections with other social variables influence everyone's health. Understanding how and why is important for decision makers and health practitioners to improve the health of their citizens. Intersectional gender analysis is the process to identify how gender power relations interact with other social variables to affect people's lives and how it creates differences in their health needs and experiences. It also analyzes how policies, services, and programs can help to address these differences.
This year's theme for International Women's Day is Choose to Challenge, which calls for celebrating women's achievements and raising awareness and taking action against inequalities. I think gender inequality is one of the most critical global issues to be addressed and one of the biggest barriers and threats to progress in global health and in development. Worldwide, major gender-related disparities exist and persist between women and men researchers. And globally, women account for only about 30% of researchers, according to UNESCO. And so although this estimate probably masks some national and regional variations, evidence shows that women's participation is still lower at leadership and decision-making levels. TDR has supported pilot schemes to enhance career opportunities for women scientists in infectious diseases. One of our objectives in strengthening capacity for research is to understand, to unpack the barriers holding back women scientists in LMICs. A good example is the Clinical Research and Development Fellowship. This is a program designed for scientists from low and middle income countries to work with pharmaceutical and research institute partners to learn how to conduct clinical trials, to develop drugs, to develop vaccines and diagnostics. However, we realized that women were significantly underrepresented among the applicants to this scheme. And in fact, in 2016, they made up only 19% of all applicants. So responding to the need for greater women's participation in this mid-career fellowship, TDR organized a crowdsourcing contest to solicit feedback from the public and to identify feasible solutions for this scheme. And some of the proposals that were implemented included, for example, improving communication and information through social media linked to existing women's associations and women's networks, showcasing previous TDR's fellows through profile stories, mentoring activities, and also making the fellowship a bit more flexible. For example, by dividing the program into 2 phases to allow fellows to return to their home institutions and visit family for a period of time. Because in reality, women disproportionately bear the burden of caregiving. And so this may complicate considerations moving away from their country for an entire year. In terms of results, these ideas were implemented as part of the 2018 fellowship application cycle, and the number of eligible women applicants increased from 11 in 2016 to 48 in 2019 and 53 in 2020. Well, still many challenges and many gaps remain, but our experience suggests that we need to develop and implement more innovative ideas to strengthen gender equality in global health training. And it's also important to note that evaluating training fellowships typically involves surveys, and while they are helpful to evaluate program activities, they do not capture perspectives of individuals who did not apply. And so our experience suggests the importance of exploring opportunities for reconfiguring institutional policies related to training programs that can enhance gender equality. And lastly, I'd mentioned that increasing the voice of women in global health training programs and learning from their experiences is key because women are not a homogeneous group. Our experience suggests this is relevant to designing research and training programs in LMICs, and that more research is needed since there is not one but multiple realities in which women live, in which women develop their careers. And in our analysis, women cannot be treated as if they all have the same priorities, the same experiences, backgrounds, or perspectives. And so it's important to remember that gender intersects with other axes of inequality, with other social stratifiers, under systems and under structures of power. And this influences why, when, and if women apply. So thank you for allowing me to share some of these experiences and efforts with you to contribute to gender equality in global health. And I look forward to the panel discussion that follows. Thank you.
Okay, thank you very much. That was Mariam Otmani del Barrio speaking from TDR at WHO. And what was really interesting from Mariam's words was that women are not a homogeneous body. They live a number of multiple realities, and this is something going forward we really should bear in mind. And so now I'd like to turn to our panelists and perhaps ask a few questions and draw really from your personal experiences for researchers in NTDs at different stages of your careers, of course, but also bringing different approaches and a lot of different experiences to the table. And as much as it's really wonderful to see organizations with the weight of the TDR putting the lens sharply on unpacking and disaggregating by gender any kind of NTD research and control issues, that's really encouraging. And so perhaps first and foremost, I'd like to turn to you, Margaret, Professor Gyapong. You've got an incredible amount of experience, more than 30 years in this field. But what's been really interesting is throughout your career, you've really made a commitment to placing socio-cultural aspects embedded into your approaches and into how you've conducted your research. So, Margaret, my first question would be, could you, quite briefly, it's certainly a very complex landscape, but could you tell us a bit more about how do NTDs affect women differently than men? What are some of the major issues they face? But also, how can female-led or even female-conducted research and health interventions improve health outcomes overall? Why is this so important, and particularly at this point?
Thank you very much for that question. It's very loaded, I must say. But let me take this opportunity to wish everybody on this webinar a very happy International Women's Day, and it's a privilege to be on this webinar. So I'm going to split the questions into two because they're quite loaded. I'll take the first one about how NTDs affect women differently. I think it's no news that gender disparities in NTDs remain quite pervasive, and across different countries and cultures where NTDs are a problem, those differences can be seen in their biological makeup, their exposure, the various vulnerabilities, access to treatment, and even the health outcomes between men and women. And let's take the woman as a woman going through her biological stages in pregnancy. First of all, it causes females with chronic helminth infections to be more vulnerable to severe helminth-associated anemia. And you can imagine what it is like a pregnant woman who is anemic and the consequences on the unborn child. But of course, we cannot also forget the consequences of female genital schistosomiasis. As a woman, is something that I'm getting very passionate about these days. All the reproductive organs are affected: the cervix, the ovaries, the uterus, the vagina. I mean, just to mention a few. And then once these are affected, you find out that women then become more prone to HIV and other sexually transmitted infections. So that's about her getting pregnant. But in an instance where you have a young woman who gets married, so you have certain cultures where women get married very, very early, 16, 17, due to religion or culture. And then every other year, this young girl is getting pregnant. You have a mass drug administration program that is going on where people are supposed to be taking ivermectin and albendazole, but she's excluded because she's pregnant. And so she misses the opportunity to have continuous treatment to allow the population to have transmission interrupted. And so you have the difficulty of the woman not taking her medication regularly. She is in an endemic area, and the consequences of not taking her drugs on a regular basis. And this is really a critical issue of access to healthcare. We talk about women having limited access to healthcare. There are publications from the IDA triple drug study, which are even showing that women appear to have more adverse events following drug administration than men. So if they are having many more adverse events, the chances are that they would not want to take these medications. And so they stand a risk of getting infected by whatever problem there is. But then even let's look at the roles that women play, going to the riverside to fetch water, carrying their children along. So they get infected. Their children get infected by schisto, which is a consequence of spending quite a bit of time in those river bodies. And then the most challenging, I'll say, is the stigma that comes with having these neglected tropical diseases. A young woman with a huge leg, oozing with pus, with a lot of sores. I mean, no guy is going to come up and approach you and say, I want to marry you. You have elephantiasis of the breast, you have Buruli ulcer. For the men, it may be same, but they have, in a male-dominated society, they have the power. And if they have money, they can go and approach somebody and get married to the person. But with women, it's not the same. Let me stop there for the differences in men and women. And let me take the second part of the question that you asked about female-led research, improving health and outcomes. And I'm not sure if I can make a statement of fact and say that once the research is led by women, we have better outcomes, because I know of men who also do research and get good outcomes. But, you know, we've also heard people say that women are our own enemies. And so we do not help others move forward in the things that they have to do. Needless to say, it is important that we look at it from a point of view as the woman as herself, understanding a woman who is facing a certain condition, relating to that woman, and trying to bring out the facts to support a situation where the woman can come out of that difficult situation in which she finds herself in. So what I can say is that when women do research for women on issues related to women, and more especially when they know or have heard of someone close to them who is affected by this, they do the work with a passion and will stop at nothing to ensure that the results are achieved. And I think it's mainly because they tend to better understand the way the women are feeling in the roles that they find themselves. I'm a Ghanaian woman, and I know what it means to be a family woman. You take care of the family, you take care of the home, you do your work at the same time. If you are sick and you don't have the needed support, or for somebody to support you, it becomes a challenge because you have to play your roles anyway. And in areas where the woman is not bold to stand up for herself, then it becomes a challenge because nothing gets done. And at the end of the day, you are blamed for not having done what you are supposed to do. And whatever you are suffering is not looked at in the light of your holistic approach to dealing with issues at the home. In certain societies, you find that women really, they don't carry the purse, but they don't make decisions on their own. They have to depend on somebody making those decisions. So as researchers, as we get closer to some of these women, we make sure that their voices are heard through the approaches that we use. I'm a social scientist, so I use a lot of qualitative approaches, interactive approaches, photo voice. And these days is an approach I use a lot, getting women to tell their stories through pictures. And sometimes it's just heart-wrenching to hear women pour themselves out through a single picture that they have taken. So we are able to listen to them and put their voices out there in the open for others to be able to hear. I remember there was a time when people just didn't understand issues about lymphatic filariasis. We had to carry somebody from Ghana to Geneva for people who had never seen a case of LF before to see what we were talking about to such an extent. And this was a woman who had lost her job and couldn't do anything about whatever it is that she's doing. But let me, however, add that in doing research of women on women and making sure that their voices are heard, we need to include the men so that they would understand the issues we are talking about. So we can't just have a group of women educating them, talking to them, encouraging them, without getting the men to understand the issues we are talking to the women about, because we are trying to get the men to support the women in whatever it is that they are doing. So I'm particularly happy about the drift these days towards male involvement in some of the things that we are doing. And hopefully there'll be a balance in addressing the needs of women in a more holistic way. I think I'll stop there for now.
Well, we don't want you to stop, Margaret. That was absolutely spot on and really important, actually, what you said on this International Women's Day about the role of men. But again, ultimately, this is really boils down, as you so clearly stated, on access and making sure that whatever it takes, the women who need the treatment are accessing it. And sometimes the female perspective and also that dialogue, you were mentioning those pictures and images, having women at every stage of that landscape of public health delivery is really important. And I suppose lots of these issues, maybe men are just not necessarily aware of them. So yeah, very important all around. And speaking of men, if there's one sector that does have a lot of men, it is engineering. May, your background's really quite interesting in that you are trained first and foremostly as a chemical and environmental engineer, and then kind of came from the WASH side into neglected tropical diseases, and now you're really focusing a lot more on some of these social and cultural aspects we've been mentioning. So May, what has your experience been of your research journey as a woman, and also what did you have any kind of particular barriers that you encountered in your field of research, whether that was in your engineering life or now in your NTD life?
Thank you very much, Mariam. Happy International Women's Day to everyone. It's an opportunity to be here. And I must say, really, that I've been incredibly lucky in my research career and my working in industry so far. And to be honest, I also must say that a great number of men have been behind this. You know, from my brilliant supervisors and line managers to my dear husband, who has many times taken over the home front when I'm away on work trips, especially when the kids were younger. I mean, I've disappeared for 3 months at a stretch or more, and he took over. So that I've been very incredibly lucky in that respect. In terms of my line managers and supervisors, because of my engineering background, there are more males. So I've been working more with men, whether it's on WASH, and then recently going into behavior change and NTDs, that interface. So that technical side of having more males in engineering research has contributed to this, which at the same time could also be a problem because we're trying to get more girls into engineering as well. And how do we do that? How do we get more girls into engineering and technology? So I've also found some amazing women who have been very supportive and have encouraged me to carry on and do my best along the way. You know, I've had female mentors who have helped guide my research in a way and my career in a way that it has gone in the right direction. Women who have understood what it means to be a woman working in research or pursuing a career, and just to be able to empathize and sometimes have a laugh at things like what it means to be mansplained to by male colleagues, or the expectation to be the one serving the tea at meetings and so on. But I do feel also that despite this success, I've had to work much more, almost twice as hard as the men, because of the additional responsibility of being an African woman with the primary responsibility of looking after the home and at the same time pursuing a career. So time management has been something that I've grappled with from being involved in additional research. This can be quite daunting. You know, you have field work, you have conferences to attend, you have to attend collaboration activities and so on. Being away from home sometimes can have its toll. It can also make you feel guilty, you know, that you're leaving your home and doing all these things. So I also do recognize that this is not a problem for women in research only, but also for women in other sectors too. Though it seems more to be more in research from my experience, since I've been on the other side as well, working in other sectors. In research as well, I've discovered that the process of the competition for research funding can be quite overwhelming and almost brutal, to say the least. Because even when you put up the best of proposals, you still end up not being successful. And then you get this feedback that says you just about missed being amongst the successful projects that were funded, you know, and then you try again for the next round, and then still you don't get to be successful. So you have to be very resilient, and it can be a bit demoralizing. You begin to wonder how excellent those other proposals must be. But at the same time, it's just the reality of academia and research. You have to keep fighting for those funds to be able to do your work, to be able to carry out your research. So you also have to be able to bring up some interesting analysis out of what you're doing. Interestingly, one of our research managers once said the feedback I received was the most positive feedback he had ever seen with no award. So that in itself has been a barrier in terms of funding. But so far, I've been lucky or successful to say. It's not easy, but there are also very many inspirational women out there who have made breakthroughs in research and who have set the pace and have set the way. So hopefully we'll be able to balance that gender divide in the near future with all hands on deck and with the men involved, as Professor Margaret has just rightly said. Thank you.
May, you've really brought up some, I mean, we could talk all day about these challenges, as you say, particularly with regards to family life and just the pure challenges of applying for funding and the research itself. And, you know, something that's been spoken quite a bit in media is this disparity, as you say, in funding awarded, but also in women not getting promoted, but also because they're not applying. And perhaps, you know, when you are juggling the home, your career, all these things, and maybe the thought of an additional set of responsibilities can sometimes be a little bit daunting. Is that something you think maybe women actually don't want to go for because their plate is so full already?
Yes, I think so. Sometimes you have to really think properly before you come to a decision in terms of where you want to take your career or where you want to go as a woman. Because in the African society, most especially, it's highly patriarchal. So if you don't have a supportive background, if you don't have a supportive spouse or partner or a supportive family, it can be very challenging and very overwhelming. So I think that has held quite a number of women back. If you decide to go the whole length and breadth of it and make something of your career, then there's some compromises that will come along. There's some consequences if you don't have that support. And I think many women are quite mindful of that and are very careful what to do, you know, what steps to take and whether to go for it in the first place or to just give up and sit back, which is very disappointing because there are very many brilliant women, especially African women that I've met, that I feel challenged in terms of what they do or how they contribute within the research that I'm doing. And it's just a shame that we have many women falling off the way just because they cannot have that support to be able to go out and do some of these things within the research sector of NTDs.
Absolutely, that certainly is a very universal thing. And what's been interesting in your words is you've mentioned several times the importance of having a very strong support network, whether it be you know, your partner at home or mentors. And so I'd just like to move on to Stella, perhaps. You've conducted a lot of research across the African continent, and how have you found so far in your career, Stella? What have been the difficulties in finding mentors who really understand the challenges, the barriers, but also the opportunities for African women in research?
Thank you, and happy International Women's Day to everyone. When we think about mentors, we'll go back to role models. And going back to what May talked about, having few women in engineering, our generation growing up, the women we saw did not have as many opportunities as we do now, the generation of our mothers and our grandmothers, and therefore did not give us role models that we would want to aspire to be, as compared to the generation that we currently live in. So the mentors that I have encountered have mostly been men and not women, because they're the ones who sort of went ahead of us And also going back to what Professor Margaret talked about, sometimes women, we are our own enemies in that men embrace us as young women easier than the women. The women would feel like, I worked hard to get here, you should also work harder. But the men would be a little bit more compassionate to hold our hands. But again, being men, there's always that aspect of wanting not to have an inappropriate relationship. So there's that bit of holding back to ensure that, the relationship is getting what you want, which is somebody to hold your hand, to be able to grow. So in that way, there's a possibility of not getting the best out of it as compared maybe if it was a woman who was holding your hand. But I feel I've been very fortunate with the men who have held my hand. I got into NTD serendipitously through my PhD supervisor. I would have otherwise been in a malaria career. But at the time which he introduced me into NTD, there was a lot of money coming into NTDs. And that gave me an opportunity to sort of grow and make a career, which maybe I wouldn't have done in malaria. So also in research, there's that element of serendipity, being at the right time, at the right place, and meeting the right people who are willing to hold your hand and to be able to take you to the next step. So then I feel that our generation, we have that responsibility to hold the women behind us and the women within, my same generation who probably have not had as many opportunities as me, because, research is about networks. So the network that you have, the more you expand it, the more you're able to fight for funding, because more and more funding has become more collaborative rather than individual, and it's more multidisciplinary. So the more we hold hands within, because now mentorship is not about somebody being older, it's just somebody who has gone ahead of you and who is able to hold your hand and also understands the kind of challenges of where you live. Thank you.
Now, that's really important what you've said, and perhaps later we can return to this in our discussion, and we'll also definitely involve the audience. So dear audience, if you yourselves have questions for our panelists, please go ahead and start adding them in the chat while we continue our discussion. I'm sure there are lots of experience here in your panel that you would love to tap into, so please do go ahead. So just to be, it's interesting because when we all actually talk about what can be done, what are the barriers and mentors, etc., we often, the conversation does gravitate towards the role of men. And so I was wondering, Stella, what about the women in a world where women account for a small proportion of researchers? What specific role, what could women do to improve the landscape for other women?
For example, in this panel, we have 4 women of different disciplines and all working in NTDs with different backgrounds and with different networks. So if we have such fora where we bring in women, especially from Africa, who lack that visibility and give them an opportunity, because I also agree with May, there are very many brilliant women out there. It's just that they haven't had the opportunity. And the people who will provide the opportunity, it's us, through such simple fora as this, where we sort of provide a platform where we can pull together, there's a call, and there's somebody in WASH, there's somebody who is an epidemiologist, there's a social scientist, and we have Shisto in all the countries that are represented here. So how can we sort of put in a proposal that is, competitive? And that also means that we are less selfish. Instead of thinking of me, we are thinking of us as women in NTDs, women in Africa, and looking at that woman who does not have the opportunity that I have.
Great. Well, we will definitely take those words on board and put them into practice, fingers crossed. And so, Chinenye, take us into the field with you. You've got a huge amount of experience in undertaking fieldwork and implementation research. And so, focusing on that now, have you observed specific challenges that were linked to gender or that were perhaps specific to women?
So happy International Women's Day, everyone. It's my pleasure to be here to learn and to share experiences. So let's go to the field. There has been some challenges I've met with during implementation and healthcare research. I'll be discussing these under 3 short points. So the first one, I'll just group it on the culturally related experiences. So these are the personal experiences. Sometimes the issues that we encounter, you find out that there are conditions where women are not allowed access or not allowed freedom to interact and move around in the community like men. For example, one of the communities where I had my research, there was a time I was the project coordinator. I came with research assistants, and we had been welcomed into the community. Then after that, we had to start up the interviews. So we are told to hold on. There is a little talk we have to, hear before we can proceed. And I was a leader. I was just listening. And the man came to ask us a question, and he's like, is there any unclean woman among us here? I was like, unclean woman? What could that mean? So quickly I thought about it. Okay, unclean. When I understood what he meant, any of us that is having our period. So he told me that a particular part of the village, the community, unclean women are not allowed to pass through that place. So that was something, and my research assistants, they were all like, wow. So, but I had to talk to them, and we found a way around that. Only those that were sure they weren't having their period were allowed to pass through such areas. It was really something for me to note. So you don't just come in and enter everywhere. So these are some of the challenges we have. Another one also was that during advocacy visits, some of the communities, women do not speak to traditional rulers. If you're a woman, you're not allowed to talk to the traditional ruler. And you are let's say you are the coordinator, you have the things to explain to the leader to, get him involved. You are supposed to talk to a male who would then go before the traditional leader to pass the information you have. That was also a challenge. Some of the coordinators told me this is something that, make them behind compared to other of their male colleagues. Then there was this issue about what we call bashiga in northern Nigeria, means don't enter a house. So women are not allowed to, you just knock on a door and you enter. Most of our women are involved in community drug distribution. So in that particular part of the country, you are not allowed as a woman to just knock and then you're just talking to the people and sharing drugs. So these are some of the encounters we've had as women that culturally related challenges. So the second one is what I would tag program related. So for this, I had key informant interviews with some of the women who were like the chief supervisors in some of the community. And in those kind of areas, some of the places are hard to reach. The topography of the area is not very okay. And sometimes there are conflicts. There are so many challenges, but majorly topography. And sometimes the place is so wide, the distance is so much that to just go there on foot or take a transportation is difficult. So the funders help out with motorcycles. So they have motorcycles for the women. So, but when I got to some of them, interviewing them, they asked me, one of them took me to somewhere where the motorcycle was parked. And she said, you're a woman. Can you drive? Just look at this. Can you drive this? And I was like, oh, I now understood. The bike looked like this sports car, like just you look at it, I can't enter. It's like helicopter. That was what they were calling it. So it's just something a woman ordinarily can't sit on and drive. And in that area, 98% of these coordinators were women. 98% of them were all women. So they told me, it's packed here. The only thing they do sometimes, they have to, from their own purse, because there was no money for that, they have to get mail and pay those meals to carry them, to go to those places. So that's one of the challenges that program related that I met. And then talking about family related problems, there were issues about security concerns. So I worked more in the village, in the communities where the people go around houses, sharing the drugs, So some of the families, especially husbands, they complained that why they wouldn't release their wives to get involved in such assignments is because they could be sexually abused. They had fears about their wives or partners being raped. How can you just allow those women to work? Sometimes the place is so far like that, So these were reasons why they wouldn't give that permission for their women to get involved. Also, some of the men, this one is perceived. I got this when I was asking them about challenges, the leaders. They said some men felt kind of threatened that if their wives were allowed to be exposed or join those kind of programs, that they might be interested in other men and they will lose them. Just suspicions like that. So a woman will tell you, I don't think I will join. My husband will not allow me. And you dig deeper. It's because the man is feeling like he's insecure. He's scared. If this woman starts getting exposure, they think the CDD work, the NTD program, they're paying them a lot. They have this opportunity to feel she's now a very big person. When she comes home, she will not be able to be under control, so to speak. So these were some of the problems or challenges that we encounter in field, or I encountered during field work. Thank you.
Thank you for those very concrete examples, Chinenye. I think what you've highlighted really is that moving forward to reach broad public health goals, and particularly now that the new WHO roadmap is out, everything's going to really be in the detail. And thankfully, the roadmap is really spurring on the need to gather gender disaggregated data and to really get a better and clearer picture of what's been working, not been working, and where to move on in terms of the next steps. So thank you for those sometimes amusing, sometimes slightly heartbreaking anecdotes from the field, but that really tell a very important and compelling story. Thanks, Chinenye. We've had an interesting comment, actually, while you were telling us your stories from Louis Aduamoa. Louis writes here in the chat, one of the challenges we must beat is the stereotype of certain careers being deemed the preserve of males only. And so really narrowing into the field of neglected tropical diseases, are there specific areas which are perceived as being more male dominated and other areas that are more kind of taken care of by women? Margaret, is that something that you've seen, or are we better than other sectors within NTDs at having gender equity across disciplines and types of work?
My background is in the social sciences, and till recently, if somebody said they were a social scientist, you were looked at as, okay, the other person. So when we are talking about the sciences, you have the doctors and the engineers and whoever you can think of, and the social sciences are an appendage to the others. So even being a woman and being a social scientist, makes it even more complicated and more difficult for you. Thank God that these days people are realizing the importance of social sciences in health. But it did not come easily. And I'm thinking of women like Karol Blasov. I'm thinking of women like Pascal and Lenore Anderson, and some who had championed the cause for a very long time, trying to ensure that the voices of social scientists and women in social sciences are heard. So professionally, you come to find out that as a woman, and especially a woman in the social sciences, you just cannot keep quiet. If your impact is going to be heard, then you have to stand up, be bold about what you know you are capable of doing, and talk about its impact on health in the area that you are working in. For instance, I found myself a social scientist working in the Ministry of Health in Ghana, which in those days, in the early 90s, research in the Ministry of Health was not a very common thing. So you are a social scientist, not any of the medical sciences, and then you are doing research. What are you doing in the Ministry of Health? What is your place? So we had to put in, and my colleagues and I had to put in the extra effort to understand the language of health, to understand what it means to talk epidemiology, to be able to say the words and not bite your tongue, so that they understand that you know what you are talking about. So today I can say schistosomiasis, onchocerciasis, lymphatic filariasis without twisting my tongue around, but then understanding the issues properly. So whatever field you find yourself in, understand the subject. But like May, she's crossed from engineering into maybe health, and she's applying some of her skills, but understand the setting in which you are, NTDs and health. A social scientist dealing with different issues, speak the language, make your voice heard, get people to understand that your discipline is relevant and is important. And a lot of the young ladies in health and in NTDs, I think sometimes are a bit shy. I started off being quite shy, and I remember Jane Kengeya saying, "Margaret, you are too shy, speak up," And some of these people, and like my other colleagues have said, pushed you to be able to be bold and stand up and talk. She said, your field is, she's a medic, but she says your field is social science. It doesn't mean it's not important. It has relevance for neglected tropical diseases and for malaria. So speak up, because you know what you are about. So yes, you take pride in the field in which you are and develop it very well, and tell yourself that I'm going to fit in the space in which I find myself in, and be able to move forward with that. Of course, you need the support system too. And they've also talked about that. There are times when I felt like giving up. And then I can hear my husband say, quitters don't win. And he always told me that, quitters don't win. There was a grant I had, it was complex with challenges. And I said, I'm done. I don't want to do this anymore. And for those of you who know him, he won't talk much, but he'll just look at you quietly and say, if you quit, you are not going to win. And I have to stay in there, So that is something I keep telling the younger ones, that you can't win by quitting. Stay in there, brace it, and things will be able to go on well for you. But the support system, I have my CDD sisters, and I'm sure quite a number of them are online. We do work with communities and community drug distributors, and we support each other. We tell each other it is well, it will work, it will happen, let's stay in there. Sometimes we are like, forget it, it's enough. And then we then encourage each other and say, let's get going and it will work. So the idea of bringing people together, encouraging one another, it's really something that works. And I think I would encourage us to do a lot more about that.
Mm-hmm. Thank you, Margaret. And I did see Professor John Gyapong register and sign into the webinar. So he's supporting you as we speak. He's right here. And this is the kind of dream team that does work and deliver results. So, round of applause to both of you. This is great to hear. I was wondering if May, Chinenye, Stella, did anyone want to add to that? Were there specific fields you felt within NTD research that kind of tend to be steered more by men or others by women? And what could we do about that? Or maybe it's a good thing, as Chinenye was telling us, maybe certain roles really are much better performed, maybe in terms of access to healthcare. Maybe women do genuinely have a better role there to reach out, since we're talking about the last mile and reaching these new goals for 2030. Would anyone like to add to that?
I would just say that it's not just about the field of whether there are more males or there are more females, but I think women generally encounter certain barriers that is very different from what men encounter, especially the African woman. So, for example, in terms of when you're publishing articles, you know, there's always this thing about publishing, or you publish or you perish. And there are very few opportunities for African women, African female researchers to publish as first authors or last authors of papers. So the barriers are quite much. You know, there's the funding that is required for publication costs, which is usually not available for the African women because most institutions don't cover that cost in many African countries. So that becomes a limitation for them. And then there's also the inability to find joint authorship to publish with people from the global north. The reality is that despite all we hear about diversity and inclusivity, if you don't have an affiliation with an institute from the global north, your chances to get your paper accepted in reputable journals become low. And this becomes a huge issue for the female researcher, especially, whether it doesn't matter which field, but generally. You also have the lack of success in obtaining funded projects where you are the principal investigator or the PI, as we say. This tends to limit your opportunity. This is also difficult because most funders are from developed countries and they will want you to collaborate with colleagues from the global north. And these colleagues from the global north end up being the PIs most times. So your chances are further limited in being a last author when you're publishing. Though in this scenario, it's much easier to be a first author. You also have the lack of opportunities for collaboration as well, which tends to cut across whichever field it is, as long as you're a woman, a female researcher, that tends to affect you one way or the other. So it reduces your capacity to publish when you are not able to find opportunities for collaboration. And many women are quite reluctant sometimes to meet up with male colleagues to form collaborations because of the fear of sexual harassment, you know. So colleagues end up becoming predators. They prey on your vulnerability to the point where it can be very uncomfortable. I know women who have had to quit completely, and it has blocked their advancement in research as a result. So it's difficult for women, and with the patriarchal culture as well in many African societies. But I just believe right now things are getting better, and it will get better with time. Thank you.
I suppose that in its own right would deserve quite an ample conversation. We had scheduled 60 minutes to discuss these issues, which was, in hindsight, incredibly over-ambitious. That is far not enough time. So if that's okay with the panelists and with the all the attendees who are still connected, would you be okay to carry on for a few more minutes? I think we still have a few issues to unpack. You've had some wonderful comments here in the chat, thanking you for your words and your advice. Stephen Ward's very proud of the women who are redefining their role in science, their involvement in NTDs. And I think earlier on in the chat, actually someone was calling you Amazons of our time. So I couldn't agree more. And so if that's okay with you, we would love to carry on this conversation for a few more minutes. We also have some words that were sent to us by Dr. Mwele Manicela from WHO to round off the webinar. So I will move on. And we were just talking, May, you're absolutely right. I think this kind of publish or perish environment is very difficult. It's accentuated in women's cases with the barriers and the challenges you've mentioned there. So Chinenye, back to kind of the way research is undertaken and this kind of publish, but also funding. As a woman in NTDs, what have been some of the barriers and challenges that you've faced or you've experienced in terms of looking for sponsorship for studies, whether it also be supervisors, training, writing papers, presenting at conferences. Mace touched on that, but what has been your experience?
Okay. If you would permit me just maybe a minute to talk into what May just discussed before I continue to answer. So I just wanted to add, you were asking about how, like, sometimes it's as if some aspects of the NTD research, more women are involved, whereas in some aspects it looks like lesser are men. So I found out that at the community level or the lower administrative level, from my experience, especially when you talk about volunteers, I think from my experience, you have more women willing to be volunteers. You see more women at that level. Like when I was in southwestern Nigeria, we did a research, all the volunteers, there was not a male. And when we tried to find out, they were like, oh, female, they are natural caregivers. How will I be going around? They felt their wives can do this, but not them. They need to go and fend. These are just stereotypes that they need to go and fend for the family. So you see in that area, only women were volunteers. So I don't know what we can do about it. Also, where I did my AR into the research, that's still the same thing. Women tend to be more ready to sit down and make agreements or change their plans, to accommodate the NTD program. Some men are not just willing to do it that way. So that's why I just noticed that it appears at that level, we have more women than men. That was what I was saying, the majority of that level, they are women. But sometimes you still find some men, and they do it very well. I think they should even be celebrated. So, but majorly, women are the ones that are willing to, do all those caregiving kind of roles. That's why it looks like there is an imbalance there. I just wanted to mention that. So talking about challenges faced as an early career researcher, I'll talk about gender-blind selection criteria. So what I mean is most times, and what I want to talk about actually will be more applicable to young women that also have young homes. At this stage where you're also growing in your career, majority at this stage, the young ones you're just getting married, you have young children, getting pregnant, breastfeeding. So I've had some of my colleagues, they will just tell you that, oh, they just can't continue because how do you balance everything? So the criteria that is set out there before you can be selected is just blind. It's just general. There is nothing like maybe, I don't know how they will accommodate women that are pregnant or breastfeeding or having young children. It appears nobody is just there. These are the criteria. If you meet it, So, but women, we are not just like the male colleagues. You have to really compete hard. We don't have all the time as they have. So I saw many of my colleagues, when it gets to that point, once they get married, they just drop. And the single ones can kind of continue. And when you get married as a single person, you get scared that, oh, it's likely I'm also going to drop. You see. So I don't know, we need to talk about all this. If there's something that can be done so that there'll be more gender sensitive to women. When you talk about selection criteria for training opportunities, conferences, whatever can be done, so that at least some more women will be encouraged, to come into the picture. The issue of supervision too. I've been around the academia I started very little, just growing a little. I found out that, most times the supervisors, once you are always around, they tend to give you many things to do. Okay, let's go. There's a field project here. Are you available? You will say yes. There is something you are available as a single person, especially I'm talking about the female. So, but immediately you get married, I noticed that even the way the supervisor will call you, he's being careful, she is careful not to intrude into your, like new status, because she won't just call you now and you say, yes, ma'am, or yes, sir. You have to go back home, discuss with your partner. And I also noticed that those kind of my colleagues, as at that level, they weren't involved again or carried on as before. They're not asking, you had a program, I didn't even know. And you don't really totally blame the supervisor, because he's also, or she is also trying to, you know, accommodate that your change, that, oh, I shouldn't also intrude into your life that way. But this same person is also, some of us have the interest to pursue, you know, you have the passion in the academia. So there is need to start thinking about how to also get them. If don't just leave them out, who knows? Maybe they have partners that will support them, or that will, you know, take care of the home front while they also come around in the research program. And then lastly, I would like to mention that as you go higher, I found out that the number of women involved in NTD research, I don't think it's only in NTD research, it tends to lower. I really think, I mean, I see that, you know, I think back about my, the institution where I've done my postgraduate programs. If I'm thinking that, I'm just calculating, I can count how many, very few women that were in NTD program. Very, very few. And one of the places there was none. You know, it was something challenging. I had to really encourage myself, and there was just no woman there. And even some of the men, they are not so approachable as a woman would have done it. So, like, I remember when I came doing my PhD here at University of Ibadan, you know, I was thrilled when I was going through some of my publications I wanted to read, and I came across Professor Margaret's profile. They are just accidentally, and I was like, wow, this is an African woman. She's a professor, and she's in TDR. I had to, you know, I was really challenged. I read a lot of the publications, and they were also related to what I was doing. I was really thrilled. Then I went on the internet. I watched her webinars. I watched some of the, like, the panel discussions like this, and she was on point. I was really, really challenged. So one of the days we are having a conference at Senegal. So I told my, like, I saw her name as one of those that will be speaking. And I made it a point that I was going to see this woman. I need to just look at her. It was a big encouragement for me, you know. So when we got there, she may not remember this, but I went there to the booth where she was, the TDR booth. And I greeted her and I said, please, you are Professor Margaret. Like, I was so like, you're meeting this person. It was a real encouragement for me. And she said, oh, this is me. I don't know whether she remembers, but I was really happy, and I told myself, you can do this. If this is a professor, a woman in NCD, she's doing this same kind of thing, you can do it. And for me, it's been an encouragement. So it will be nice, even as supervisor at the higher level, let's get more women coming along. It's an encouragement to those of us that are young. You look up and really, they've really achieved. You know, it makes you brace up. You don't really have that excuse. Just find a way around and keep climbing. Thank you.
That's really fantastic. And thank you for those thoughts. I'd like to just perhaps finish with asking a similar question to Stella. Stella, you are at a, you know, you're undertaking lots of research. You're slightly more advanced in your career than Chinenye. And so from your perspective, how difficult has it been to find funding and opportunities for research projects, maybe more specifically related to being a woman?
Thank you. So, like I earlier mentioned, and as the others have mentioned, funding is very competitive, and there are certain points we need to have achieved, certain papers, you know, have a certain number of papers as first author, a certain number of papers as last author, and starting out is not easy. That is why mentorship is very important, because if you have a mentor riding on their back, then it's possible to get a grant. My PhD grant was based on that. My supervisor, Professor Brooker, was already in NTD, and we developed a question together. And after that, him recommending me to other people and using the network that they know, then they are able to accommodate me. So starting out is not easy, but as you grow and get more collaborations, nowadays it's hard to get individual funding. Funding is mostly, you know, multi-institutional. So you're part of a consortium, which then you continue to to build your research profile. So I would like to thank the RNTD, because that's one such grant that has taken a risk to unknown people like myself and gave us a grant. And that way we continue to build our profile. And then now it is the honors on us to also hold the hands behind us so that they can also build, their research profile. Yeah.
Absolutely. And this is maybe quite a bold move, but we were talking about the Global North earlier on, and given that a huge amount of organizations who are very willing to fund and engage in this space, but their headquarters are in the Global North, very few are in the Global South. So maybe there's time for small adjustments, but also time for very big ones as well, in kind of shifting the balance. It's probably a good time now to hear from Dr. Mwale Malechela. Dr. Malechela has pretty much done it all the way from the PhD to rolling out nationwide disease control programs, and now obviously with a very strong career in international organizations within public health. So I'd like to hand over to Dr. Mwale for a few words, and then perhaps we can come back to our live panelists and wrap up this session with some of your wise words to see us through to the next International Women's Day. But in the meantime, I will just hand over to Dr. Malechela, speaking to us from WHO in Geneva.
Thank you so much for such an inspiring webinar today. It's so wonderful to hear from so many women who excel and will continue to excel in their fields. I've been very privileged and fortunate down the years to have worked with a great many incredible women and many profoundly impressive people, both scientifically and as human beings, in the challenging, often difficult, and sometimes unfashionable field of neglected tropical diseases. I started my career as a junior scientist in the field of lymphatic filariasis, and as this work developed, I founded and became the director of the Tanzania Lymphatic Filariasis Elimination Program. When I became Director General of the National Institute for Medical Research in 2010, I was incredibly proud to be the first woman, and by definition, the first African woman to hold the position. It was with similar pride that I joined the Office of the Regional Director at WHO's Regional Office for Africa, and before becoming the Director for the Control of Neglected Tropical Diseases in 2018. During my career, being a woman has been challenging. I have often felt that I had to work just as hard to fit in with the professional networks and to be heard as I have to work at my actual job. However, it has also been exciting and incredibly fulfilling. I feel immensely lucky to have been able to have had such a varied career, one in which I've had at times the freedom to build my own path. It's been lonely at times, yes, but very rewarding. As scientists, a fundamental principle of our work is based on recognizing and removing bias from our studies. And just as I believe in the scientific process, I believe in recognizing and removing bias from our social and institutional processes. As it makes us better scientists, so it will make us better societies and people. It will unlock the incredible potential I know and we all know is out there. The importance of unlocking the potential of our female colleagues around the globe so they do not have to fight quite so hard to reach their potential cannot be emphasized enough. And I believe that the responsibility for doing that belongs to all of us. As much as I've faced challenges in my career, I do, however, consider myself fortunate too, in as much as I've always been able to count on the support and encouragement of many wonderful female colleagues along the way who have supported and encouraged me ceaselessly. This is not to say that I have not had male mentors. I indeed have had, but I do really recognize these wonderful female colleagues who in many ways have understood the journey that I too have gone through and were able to mentor me with that empathy in mind. I hope in turn that I have been able to support and encourage some of the talented women it has been my privilege to see develop in my field. The way is long and there is still much to be done, but if we care enough and if we're obstinate enough, we can ensure that change is not just something to be glanced at a distance, but something we can ensure happens. I look forward to welcoming more and more talented women into research in NTDs. I look forward to supporting them, collaborating with them, and learning from them. I thank you.
Some wonderful words and really warm encouragement there from Dr. Malechela for women in Africa who want to pursue a career in research. And panelists, you're also getting an incredible amount of thank yous for your words. It's been actually a very personal session, so it's a double thanks that you kind of opened up and shared some of these sometimes very personal and other times kind of very professional thoughts and words on these topics. You've had some applause. Jennifer Giovanoli is saying thank you very much. Lisette Van Lieshout writes, thank you for this very interesting discussion, inspiring to see what has been gained in the last 20 years. Still a lot to do, but every step is one. Lurette Lar, well done organizers, panelists and participants. So all round, a big round of applause from everyone who joined today. Before everyone goes, I do think we should give all our attendees today a little bit of homework. It would be good to hear from you now that we've heard about a lot of the challenges. Perhaps what your key asks or recommendations to the NTD community, what would they be to support African women in NTD research at every stage of the way? So perhaps Margaret, over to you. We'll start with your advice and your ask to our community.
Okay, thank you very much for that. But let me say that in this world of science, in this world of NTDs, nobody's going to lower the standards for you because you're a woman, okay? The standards are set, the standards are there. You'll see call for proposals that say women are especially encouraged to apply. It doesn't mean that your proposal is going to be looked at in a less critical way than the men. So like I keep telling I have 3 daughters, like I keep telling them, hard work never killed anyone. And I tell the people in my office the same thing. So to my ladies, I'll say, let's continue to work hard. The hard work will pay off because nobody is going to say, because you're a woman, the standards are going to be lowered. Chinenye, it's difficult to know that as a woman, you have to perform all the different roles that you have to perform. And it takes a special person to recognize the fact that the woman is doing additional things on top of doing her research. We hope that in the not too distant future, people would recognize that and be able to appreciate the extra effort that women are putting in. But in the meantime, I would encourage all of us to work hard, let our voices be heard, and be encouraged that there are people there to hold your hand and to support you. And quitters don't win. Thank you.
May.
Yeah, so I would like to say that for the NTD community, what we should do is to improve the experience for women. And mentorship is very important here. I think Chinenye's testimony of her relationship with Professor Margaret is an example. We should encourage targeted mentorship, especially from women, and also have concrete career development plans so that women are not having to dig their own path on their own. We should support each other and lift each other's hands up to carry on in the way. Women should also be acknowledged more and given the opportunity. You know, training is very important. So they can be trained on different skills that are required to make a success of their research career, because already they're grappling with too many issues at hand, family, career, you know. So if they're being trained more and they're guided through the process of how to go about whether it's writing proposals or writing papers, and getting those necessary skills for data analysis and other things that will help to improve the lot of women. And generally, not just in the NTD field, it's really very difficult for women when they've given birth, because in many African countries, it's just a short 3 or 4 month paid maternity leave that is available. And you end up having to grapple with that subsequent pressure of childcare issues, having to return to work after just 3 months of giving birth. This on its own can be mentally demanding and can leave you in a psychologically bad place. So probably flexible grants can be provided for women for supplementing salaries for an additional 2 or 3 months, so that they can have that extra couple of months to be with their babies at home before returning into full-time research work. And also considering women from leaders from LMIC countries. There should be more flexible grants in terms of leadership grants for them, and looking at how to also increase the visibility and exposure for African women generally. So I think those are the things that the NTD community should be considering to help the African female researcher to make progress in NTD research. Thank you.
Thank you very much, May. And what about you, Stella? What would be your recommendations?
Thank you. So one would be create more research networks where women can interact more and meet and be able to, come up with proposals or even just challenging environments as to what is happening within the African continent. And secondly, I would like to encourage women out there. We all need a support system, and we can choose a mentor that we want. And sometimes it just takes you reaching out, and it doesn't have to be somebody older than you, but somebody who has gone ahead of you, and they may be younger than you, but that relationship does put one in focus, put one in check, and help one to have a successful career. Thank you. And lastly, is more grants that are more attainable, like the RNTD through the core NTD, that women can use as a platform to launch out. It's not really lowering the standards, but just providing opportunity that would otherwise have not gotten. Thank you.
Absolutely, and it's important to note that 2 of our panelists are small grant recipients from ARNTD and Core NTD, so congratulations to both of you. And finally, Chinenye, what are your asks and recommendations for us all here tuning in today?
Okay, so my recommendations, firstly, to the NTD community and the academia generally, is to try to have gender-specific selection criteria, if possible. I know sometimes we see females, like Prof said, females are encouraged to apply. But we don't really know what exactly does that mean. I believe that's a good start. But like Dr. May was talking about, when you put to bed, you could have some psychological issues, and she was talking about adding more months. What exactly, can it be more specific? It will give you that sense of, okay, I mean, you are being accommodated or something. If that's possible, that'll be a recommendation from me. More gender-sensitive selection criteria for training opportunities, conferences, as much as possible. And that doesn't mean we'll be lazy, but just to encourage women. And then, if possible, I mean, our supervisors should also be more considerate and accommodating to young women in this stage of life. Some are really passionate and interested, it's just that there are so many things to juggle with. So don't just leave them and allow them because, oh, you don't want to disturb them, they are now married. Try to bring them along, counsel, talk to them. That's even why we need more women. You would understand, and it's easier to say, hey, my students, you've not been here, and I did this. This is how I went through during my own time and all that. So our supervisors, male, female, should be more understanding, to carry those people along, be more patient and all that. I also would like to say, if possible, we should have more women only kind of, I don't know, like research grant. If there's something about just specific to women, just to add in our applications for trainings, just to do some. They'll put their women only. They can put for pregnant or for, something like that. Child that just put to bed or have young child of this age, just a little thing like that. It could also bring more encouragement. And then for our families, I think all that we are saying, and I learned from all my seniors here, if you don't have a supportive family, partner, spouse, it won't be funny from what I've heard. So, I mean, this is also an opportunity to celebrate our fathers who trained the girl child. If not that my father spent time, made up his mind to train, I wouldn't be here today. I'm in a family, we have 5 females and 1 male. And my father never said, oh, this is a female, this is a male. We are all given quality education. And I thank him every day. That's why I'm here today. So kudos to such fathers. And we are praying that more of our fathers will get that understanding. Also, husbands that support their wives. It's a time to also celebrate to you all. Let's keep doing it. Our success is also your success. So, and then to my fellow women, let's keep working hard. Already, it's a lot of competition for us. Don't give up. Some of our mothers have made it. So if possible, you can get care. You can just do something. We have in our programs, maybe a schedule for this. You can also block some time and just make sure you are giving it out for academic work. Just be resilient. As far as these our mothers have made it, you can. So let's not give up. And we're not saying all these things so that we become lazy and say, oh, I'm married. They should. No. We should have that passion, that zeal, and that resilience to pursue. And I believe we'll really go far. Thank you very much.
Thank you so much. Thank you to all 4 of you. I think Dawn Maranga here has summarized it perfectly. Excellent webinar. Feel exceedingly encouraged as an upcoming woman scientist. Thank you to all the panelists. So I think something very positive has been achieved here today. I'm also going to borrow Stephen Bramer's quote here. When you educate a man, you educate an individual. When you educate a woman, you educate a nation. That's very well said. Fantastic. And so to everyone who's been involved today, thank you so much. We really, of course, thank our panelists, but also to you, the audience. You've been really wonderful. I hope that we all are able to take on board some of these funny, some of these rather serious anecdotes and points that we've discussed today, and really take that home and work on it, build it into our everyday life. It seems that in one sense, maybe the COVID pandemic has kind of allowed us all, through these Zoom meetings and the fact we were all working from home, the secret's out the bag. We all have families, we all have cats and things going on in our lives. So I hope that a little bit of that will stick with us, and that we will be a little bit more forgiving and flexible when it comes to all these things that we are trying to juggle. And so finally, before I leave you, I just want to give another huge thanks to everyone who came together and made this webinar possible. So here's a lovely slide. Of course, all our wonderful speakers, and also the Global Schistosomiasis Alliance, the GSA, Core NTD, SCI Foundation, and the African Research Network for Neglected Tropical Diseases, ARNTD. So from us here at ISNTD, big thank you and goodbye until we meet again. And please enjoy the rest of International Women's Day. Perhaps have a little break after all that hard work over the years. Enjoy your day. And we hope to see you all very, very soon. Thank you to everyone.
Thank you.
Thank you.